Welcome back. You're watching Chartbusters on CNBC-TV18, and let's get to a CNBC-TV18 exclusive now. Dr. Robert Califf, the chief of the US drug regulator, the US FDA, caught up with Ekta Batra on his maiden trip to India in an official capacity. Listen in to his thoughts on the recent spate of incidents of contamination of drugs with diethylene and ethylene glycol and other substandard drugs. Listen in.
I would say it affects my view, but it's not that my view has changed. It just strengthens the concept that there should be one standard for all pharmaceuticals, regardless of the country that it's going. We have confidence that when it comes to generic drugs, for example, the drugs getting into the U.S. are very high quality because they go through so many steps of checking. There was a bit of a loophole on the eye drops for that particular type of material, and we're getting Congress to change the laws so that we do have more authority to intervene there. But what happened with the ethylene glycol contamination, those were drugs going to other countries under a different standard than we use. And you know, it's tragic enough when adults die from something like this, but children is just unbearable. So all this does is just strengthen the concept that we need to have a very robust regulatory system, high quality inspectors, a lot better information exchange, and more than anything else, I mean, you have 1.5 billion people here or so in India who need high quality pharmaceuticals too, and so there's so much in it. It's not just about us in the U.S. There's so much in it for India to get this right.
Well, you know, just on that point with regards to diethylene glycol as well as ethylene glycol, the view is that the supply chain is probably contaminated with the substandard ingredients, and there's a possibility that we could see further incidents in the future simply because we can't track the supply chain so closely. As an FDA, as the head of the US FDA, what would your opinion be on that, and how would one probably try to curtail it?
Well, I have opinions, and then I have what I'm legally allowed to do. And my opinion on this is very clear. There is no reason in 2023 why we shouldn't have digital access to the entire supply chain. I would envision a map on a wall that's digital where you could see all the material and the amount of material as it goes from being, I remember that the starting materials for most drugs are really petrochemicals, much like you would find in other things that are made that are non-medical. But we should be able to keep track of how much there is and where it goes, and the testing that's done can be integrated with that information. This is also important because let's suppose somewhere in that node, I use the example of a tornado because a Pfizer plant that's just a few miles from where I live was hit by a tornado and took out a very large supply of generic drugs. You know, let's say that happens. For us to recover, being able to look and see where the supplies are and put them together is important. But it's also true that since these materials go through the supply chain, that if you found a root cause problem early in the supply chain, you could deal with it much more quickly in terms of where all the different aliquots of that supply have gone.
All right, so that was some interesting conversation coming in from the US FDA Commissioner with all